Hi, I'm Andrea Smith and I use she, her pronouns.
Hi, I'm Kiefer Hunt and I use he, him pronouns.
Welcome to our second video of our Mental Health Awareness Week series. Today's video will be on different kinds of mental illnesses. Don't forget to check out today's event, which is dog petting in the PTA Centre changing rooms.
Mental health exists on a spectrum. Most people will have ups and downs, which is a normal reaction to daily life. For example, stress is probably a common emotion for most students. It can be a good motivator, but it can also be overwhelming. Having a good foundation of well-being can be useful for being resilient to stress.
Some ways that you may be able to tell that you're experiencing too much stress is by various physical symptoms, such as headaches, fatigue, and sleep problems, and the impacts it can have on your mood, such as feelings of anxiety, lack of focus, irritability, and feeling overwhelmed.
Sometimes emotional and physical symptoms caused by mental distress can have a prolonged impact and affect your functioning day to day. This can be indicative of mental illness, a catch-all term for conditions that affect your mood, thinking, and behaviour. We're going to go through some umbrella terms for disorders that you might recognise. We only have time to explain these in brief, uncomplicated ways, so we can't communicate the nuance of every disorder.
Mood disorders affect your general emotional state. It often involves overwhelming feelings of sadness, the inability to sleep, a loss of interest in things you once enjoyed, changes in appetite, and many other things. Mood disorders include major depressive disorder, bipolar disorder, and seasonal affective disorder. When people say they have depression, they're usually referring to major depressive disorder.
Anxiety disorders frequently cause intense, excessive, and persistent worry and fear about everyday situations. They can often involve episodes of sudden feelings of overwhelming anxiety, along with physical symptoms which we refer to as panic attacks. Anxiety disorders include generalized anxiety disorder, social anxiety disorder, and post-traumatic stress disorder.
Obsessive-compulsive disorder is sometimes categorized as an anxiety disorder. It often involves obsessions, which are unwanted, distressing thoughts that lead to compulsions, which are repetitive behaviors that get rid of obsessions.
Eating disorders involve persistent eating behaviors that negatively impact your health and emotions. Often they involve focusing too much on your body shape, your weight, and your food, which can lead to dangerous eating behaviors. Eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder.
Psychotic disorders involve psychosis, which is an impaired relationship with reality that can include confusion, hallucinations, which is seeing and hearing things that aren't there, and delusions, which is believing things that aren't true. Psychotic disorders include schizophrenia and schizoaffective disorder, but other mental illnesses can include psychosis.
Personality disorders are said to include a rigid and unhealthy pattern of thinking, functioning, and behaving. However, this may not seem unusual to the person as it is their normal way of being. Personality disorders are grouped into 3 clusters. For example, paranoid personality disorder is cluster A, borderline personality disorder is cluster B, and avoidant personality disorder is cluster C.
Dissociative disorders involve repeated episodes of dissociation, where your sense of reality and who you are, such as your thoughts, feelings, and memories, become disconnected from one another. This manifests in different ways, such as depersonalization, which is disconnection from yourself, and derealization, which is disconnected from your surroundings. Dissociative disorders include depersonalization disorder and dissociative identity disorder.
All types of mental illnesses are stigmatized in different ways. Stigma refers to the widespread negative attitudes and beliefs about people with mental illnesses, which can often lead to prejudice and discrimination. It is useful to take a look at your preconceived notions of people with mental illnesses and do some research to expand your understanding. Often ignorance will cause fear, so the way to combat your possible negative feelings is education.
All people deserve respect, support, and treatment, regardless of other factors. Even within a single condition, there can be lots of variety. Everyone copes with their struggles differently, so there isn't a benefit to comparing your struggles to someone else's.
The common thing of all mental illnesses is its impact on day-to-day functioning. If you're having trouble, we recommend reaching out to someone or getting professional help. Keep an eye out for tomorrow's video to see where and how you can get help. Today's whakatauraki is He oranga nākou, he hikinga wairua.
When it touches your heart, it lifts your spirit.